As a parent or caregiver, it's natural to guide or help your child with their arm when they need it. But have you ever heard that pulling on a child's arm could actually lead to an injury? It might sound surprising, but it's something known as nursemaid's elbow, a common injury that many families overlook. In today's video, we'll explain what it is, how it happens, and what you can do if it affects your child. Nursemaid's elbow, also known as radial head subluxation, is a partial dislocation of the elbow joint. It occurs when the radius bone slips out of place from the elbow joint, often after a sudden pull or twist. This injury most commonly affects children under the age of 5, whose ligaments are still developing and more prone to injury. It's not a serious injury, but it can be very painful for your child and can make them reluctant to use their arm. Nursemaid's elbow usually happens when a child's arm is pulled or twisted in an abrupt motion, like when a parent or caregiver is trying to pull their child up, stop them from falling, or get their attention. The most common scenario involves a parent grabbing their child's hand or wrist and pulling them quickly. This motion can cause the radius to slip out of place from the elbow joint. The child will often refuse to move their arm, showing discomfort or pain. The most obvious sign of nursemaid's elbow is that the child refuses to use their arm. They may hold their arm close to their body, not wanting to move it. This happens because the injury causes immediate pain and discomfort. The child might even cry or become upset, especially when you try to move their arm. You may also notice them protecting the arm or keeping it in a fixed position. However, there won't usually be any visible bruising or swelling at the site of the injury, so it's not always easy to tell at first. Fortunately, nursemaid's elbow is easy to treat and usually doesn't require any surgery or long-term care. The most common treatment is a simple maneuver done by a healthcare professional, known as reduction. This involves gently manipulating the elbow joint to slide the radius back into place. It's a quick and mostly painless procedure that will have your child feeling better almost immediately. After the procedure, your child should be able to use their arm again without pain. It's important to avoid pulling or jerking on the arm in the future to prevent recurrence of nursemaid's elbow. Thanks for watching. If you found this helpful, don't forget to hit that like button and subscribe for more health tips every week. This is Healthy Life, where your wellness comes first. See you in the next one.